Showtime.
Okay, good afternoon. My name is Patricia DePina Law. I am a South University student. I am in an advanced health assessment class, and I have a patient with me that will be allowing me to do a head to toe assessment on her. Her name is Aubrey. Aubrey is 25 years old. She is basically in good health. I already have done a Snelling test on her, and she is 2020. I have already taken her vital signs and recorded her height, weight, and BMI. I have also checked on her weight, and she is of normal weight at this time. I have already washed my hands and introduced myself to the patient. Okay, to begin her general survey, I am taking note of the patient's appearance, general skin appearance, noting any lesions, any marks, any masses, any lumps, and anything abnormal besides her tattoos, which do not seem to be infected. She is dressed appropriately. She is in no signs of distress. She is healthy, as I stated before. Now, I'm going to begin with the head and face as far as her assessment. First of all, I am going to palpate her scalp, and I'm noting any alopecia, any nodules, any lesions, anything out of the ordinary. I am also going to check for her hair distribution, which she has a lot of hair, as you can see on her head, and there is no problem. I am inspecting her face for symmetry. Again, I'm looking at her appearance, making sure there's not anything unusual. It seems like her facial is within alignment, as well as her neck and her ears. I am going to go ahead and palpate her post-auricular, her pre-auricular, her neck, noting for any JVD, any nodules, masses, and the like. I am going to ask the patient to go ahead and yawn for me, puff out her cheeks, move her jaw from side to side, and I'm checking her cranial nerves. I am also going to ask you, Aubrey, to please raise up your eyebrows. Okay, close your eyes real tight, open them up for me. Okay, thank you. I already spoke about checking her visual acuity, which she is 20/20. I'm going to now assess her peripheral vision with confrontation by the finger wiggle test. Aubrey, just tell me when you can see my fingers wiggling.
What's up here and over here?
Can you see my fingers wiggling? Tell me when.
I can see it.
Okay, good. Okay. I'm also going to assess for the 6 cardinals, okay, her abducens, her trochlea, and oculomotor. The 6 cardinal fields, I'm going to note symmetry and movement of her eyes. And I want to know if she has nystagmus. So, Aubrey, if you wouldn't mind, without moving your head, if you can just follow my pen. Thank you. Moving on, I'm going to check her conjunctiva. I'm going to check her cornea and iris by performing the ophthalmoscopic exam, noting red reflex, retinal in her internal structure.
You take your glasses off.
Yes. If you would not mind removing your glasses, Aubrey, that would be great. Okay. Not sure the lighting coming on this one, but okay. Okay, thank you. Okay, I did notice the red reflex in her eyes and also her internal vessels. I'm moving on to her ears, and I am inspecting her ears or auricles. I'm looking also for symmetry, anything abnormal. I am going to pull on her appenna and her tragus. Do you have any pain when I did that? Okay, thank you. All right. I'm also going to assess her the Weber and the Rennie test. I'm assessing for ear and bone conduction. Aubrey, just let me know when you which ear you feel this out of. What ear do you feel that out of? Can you feel that? Tell me when the sound stops.
Oh, the sound? Yeah.
Mhm.
I heard it.
I'm going to put it on top of your head now. Just tell me when you feel the sound stop. Okay. Which ear did you feel it out of?
Left ear.
Okay, thank you. Okay, all right. I'm also going to check her ears. I'm going to check her ears for patency. I'm going to check her turbinates, and I'm going to go ahead and check and see if she can determine any type of smell that I present to her. Sorry. Getting this to get put on. Doesn't always snap on the way I want to. Did earlier for me. There we go. There we go. I'm going to pull her ear up and back. Oval, pearly white. No cerumen present. Tympanic membranes clear to all. Okay. Now I'm going to go ahead and palpate her mandible, her submental. And I'm going to go ahead and check her nasal turbinates. Just put it out. Nasal turbinates are clear to all, and they are patent. I am also going to move down to her mouth and throat, and I'm going to assess her lips, her gums, her teeth, her tongue, oral mucosa, and her hard palate by using my tongue blade. I will first put on my gloves for this assessment. Sorry, we just inherited a baby during the exam for a moment. That was unexpected. Okay, Aubrey, I'm going to assess your lips. I'm going to assess your gums. You open your mouth for me, please. Gums are nice and pink. Good dentition. I don't see no abscesses or anything like that to see that she has anything. I'm also going to open your mouth for me really wide. And I want to assess her tonsils, the 2+ midline. Can you swallow for me? Uvula midline. Can you stick out your tongue? Okay, good. Okay. Hard palate, soft palate, everything's in place. Okay. I see your tongue, please. I'm moving her tongue from side to side, making sure there's not any deviation or anything else that's going on with that. Okay. 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 When she swallowed for me, her uvula was in place. Yeah, and I already mentioned her tonsils. There's no erythema, no edema, exudate. I am going to go ahead and the next ask the patient. I already asked the patient to stick out a tongue and any type of symmetry, and that was all clear. I am going to move down to the neck, and I am going to assess for carotids, any type of her range of motion, and I already palpated her post-auricular and her pre-auricular, and I'll go ahead and move on to the other ones. I'm hoping that you can see me, Dr. Wilson Romans. I'm sorry. Again, I'm palpating supraclavicular and any other nodules that may be. And I'm going to do it from the back since it's easier for me to do it. Can you swallow for me, Aubrey? Okay, good. I palpated the thyroid gland anteriorly and posteriorly, and there was no enlargement, tenderness, or nodules. I am going to pause at this moment until we can get the baby back to mom and move on to the shoulders and upper extremities.